Good morning, Washington State. This is Amanda Pauley with DBHR. I just want to let you know that Miss Marley and myself will be starting here in about 4 minutes, give or take. We have about 300 registrants for this webinar today, and we want to give everybody an opportunity to log in. So hold tight, and we'll be right with you. Okay, so we're going to go ahead and get started now. Once again, my name is Amanda Pauley, and I am here with you from DBHR, the Healthcare Authority. And I would like to introduce to you Ms. Marley Hawkendonner from the Northwest Fair Housing Alliance. Today, Marley is going to talk to us about assistance animals and fair housing and what that looks like for our Washington State residents and what that may look like for you or the individuals who you serve, and how we can all keep in mind the laws around that. And Marley, go ahead and take it from here. Thank you very much.
Thank you, Amanda. Well, good morning, folks. Nice to see a good crowd online here. Looks like we have about 120 plus people so far. Appreciate you taking the time. If you're like me, this is probably your 20th webinar in recent weeks, or Zoom meeting, or whatever digital format you're using. I'm broadcasting here from my home office in my basement in Spokane, and I'm sure many of you are working at home as well. We at Northwest Fair Housing Alliance, we're figuring out now how to do our transition to getting back to the office in a slow, measured, cautious manner. So that brings all kinds of other challenges, figuring out the appropriate protocols to keep everybody safe. So thanks for taking time to spend some time with me this morning learning about assistance animals and the Fair Housing Act. It's a topic that always gets a lot of interest. There's a lot of confusion around it. There's a lot of strong feelings about animals in housing. People seem to either be for them or against them. There's often not a lot of middle road when it comes to allowing tenants to have animals in housing. And so, and there's many different laws as well. And so that adds to the confusion. So hopefully we will dispel a little bit of that today. HUD has recently issued some guidance that I'm going to be taking much of this presentation from in January of this year. And so I'm going to be referring to that guidance, and that'll be a good resource for you to check back with as well. There's also as a handout, a short article that I had prepared earlier this year, and I attempted to summarize the HUD guidance, which is about 19 pages, and I got it down to about 5. So the article that's attached as a handout for your download is a summary of the HUD guidance. So again, that can be a resource for you as you try and navigate animal issues in housing for people that you work with and serve who have disabilities. So that is the plan today, just to navigate the guidance from HUD. And if there are questions, you can go ahead and type them in. As I'm presenting, I may not always catch them. If Amanda is keeping an eye out, she may be able to interject. If it's a topic that I know that I'm going to be covering, I may say, hold that question, I'll address it in a little bit. And at the end, hopefully there'll still be some time for questions as well. So if you have any technical issues that you think might be on my end, please also type that in and let me know. Hopefully you can all hear me and see the screen okay at this point. So we are going to be talking about the Fair Housing Act and assistance animals for people in housing. And the Fair Housing Act provides protections for what are referred to as protected classes. So assistance animals are going to fall under the disability protected class. People with disabilities, yes.
People are having an audio issue. Can you hold on for a moment?
Sure.
Or just getting a few comments in the question box. Can anybody let me know if you can hear this? Can you? Okay, so that's what I call in using my phone. And I'm not having any issues. Okay, so I'm hearing, now I'm seeing a lot of I can hear fine. So, oh, good. So if you're having issues with audio, sometimes calling in using your phone is sometimes a better option depending on internet service, or sometimes internet drops or whatever. So if you do have an issue throughout the webinar with audio, please just call in with your phone and then reconnect. Just to be able to view the slides with your computer. But thank you for making it. Oh, good. So people can hear. Oh, Stanton, it's nice to see your name again. So sorry to interrupt, Marley. I just wanted to make sure that this wasn't just this wasn't for everybody, that it might have just been 1 or 2 people who were struggling. My apologies. Please keep going.
No, absolutely. Yep, and yep, it can always end up on my end as well. We're all kind of dealing. It seems like we have, one hand tied behind our back sometimes with this technology in this new era. But hopefully, Hopefully it's just a couple of issues and people can get reconnected. So, okay, so disability is a protected class under the Fair Housing Act, the Federal Fair Housing Act. There's 7 protected classes. Disability is by far the protected class that receives the most complaints filed with HUD that are received in our office as well. We serve 17 counties in Eastern and Central Washington. That's really a national trend. And part of that is because there's more provisions in the Fair Housing Act with respect to people with disabilities. And it's a newer protected class, although not that new anymore, 1988. So arguably, there's less understanding about it, although hopefully housing providers are understanding that it is a protected class at this point. But we're an aging population as well. And as we get older, we may incur disabilities, and that increases the population of people with disabilities. And so I don't think we're going to see any change in that trend of people filing complaints based on disability discrimination more than any other protected class. So the kinds of issues that arise under the Fair Housing Act with respect to disability include reasonable accommodations, reasonable modifications, and design and construction for accessibility. We're going to talk about the first one, reasonable accommodations, because having an assistance animal in housing is really just a reasonable accommodation. So modifications are physical changes to the structure. If you need to insert a ramp or grab bars in your bathroom or lower countertops, something like that. So those are reasonable modifications. And then there are construction requirements for multifamily housing built after 1991 so that it's accessible or adaptable for people with disabilities. But we're going to talk about reasonable accommodations and then specifically assistance animals as a reasonable accommodation. So a reasonable accommodation is an exception to a rule or a policy that's needed by a person with a disability to use and enjoy their dwelling unit. So there are as many types of accommodations as there are people. Everybody's needs are diverse, and some accommodations come up over and over again, like assistance animals or reserved parking spaces or need for a live-in caregiver. Those are all common types of accommodations. But the accommodation analysis is quite simple, actually. And so remember this when we get into the assistance animal discussion, because that sometimes seems overly complicated. And it really comes back to, in order to have an assistance animal or any type of accommodation, a person needs to have a disability. There needs to be a nexus or a connection between the disability and what they're asking for as an accommodation, whether it be the reserved parking space or an assistance animal or something else. And then the third prong is it reasonable? And the things that factor into whether something is reasonable or not are whether or not it's an undue financial or administrative burden for a housing provider. So a reasonable accommodation shouldn't cost a housing provider a lot of money to implement. The larger a housing provider, the more it may be deemed a de minimis, a small cost to the housing provider as compared to a smaller housing provider. So it's going to be very fact specific as to whether something's a financial burden. But generally, a reasonable accommodation is just changing a policy or making an exception. And so it doesn't usually cost any kind of money. Shouldn't be a financial burden for the housing provider. Similarly, it can't be a fundamental alteration to the business. So if a housing provider is not in the business of providing supportive housing services, it's probably not a reasonable accommodation for somebody to request that their manager drive them to the grocery store or come in and administer their medications, something like that. That would be a fundamental alteration to their business. So if an accommodation request is reasonable, the housing provider should grant it, assuming the first two prongs are also met, that there was a disability, a nexus, connection to the disability for what's being requested, and it's reasonable. If it's not reasonable, a housing provider should enter into an interactive dialogue with the person asking for the accommodation. That just means a discussion about, rather than an outright refusal, it might be a suggestion of an alternative. We can't do this. We don't think we can do this for you because this is why we think it's unreasonable. However, would this work? You're asking for a reserved parking space, but the one that you want is already taken. Could we put you on the waiting list for that one and give you this one over here instead? It's just a discussion, trying to see if there is an alternative that will work for the person with the disability. So that's really the overlay that we want to remember as we get into analyzing assistance animals in housing. So again, there's all kinds of accommodations that can arise. A lease extension, an early termination if somebody needs to leave early to go into assisted living, or they can no longer do stairs and they're on the 3rd floor. They might ask to get on the waiting list for the first available ground floor unit. They might ask for a release from their lease if they can't live there anymore. So there's many kinds of accommodations. So moving now into the realm of assistance animals as a reasonable accommodation, this does get confusing for people because there are so many different laws. We're going to be focusing on the Fair Housing Act, but there are other laws that may apply to a housing provider as well. The Fair Housing Act applies to all housing, market housing, as well as subsidized housing, with the exception of a couple minor exceptions for smaller landlords that only have a couple of units. And I'm not going to go into detail on that, but housing providers should be sure that they're not covered before they assume that they're not covered by the Fair Housing Act. So with the exception of some smaller landlords, the Fair Housing Act applies to most housing. And many people are surprised sometimes to hear that it applies to market rate housing as well as and private housing as well as subsidized housing. So in addition to the Fair Housing Act, housing providers may be covered by other laws, such as the Americans with Disabilities Act. The Americans with Disabilities Act applies in private housing, as well, though, to common and public areas. So the leasing office would be covered by the ADA. So generally it applies to public spaces, public accommodations, but it can still come into play in some areas that are open to the public. If a recreation room is available for use by the public, for reservation by the public, then the ADA will probably apply to that space as well. And then Section 504 of the Rehabilitation Act applies to recipients of federal funding. And then we have the Washington Law Against Discrimination as our own state law here in Washington, quite similar to the Fair Housing Act. There are a couple of distinctions, but as far as the small landlord exception, it's even stricter. So again, more reason for a smaller landlord to really verify that they're exempt from fair housing laws, because even if you're exempt under the Federal Fair Housing Act, our state law only exempts the small landlords from having to give reasonable accommodations to people with disabilities. Everything else applies. So there's some different laws that apply. The Fair Housing Act is, again, what we're going to focus on. And it uses the reasonable accommodation analysis. Is there a disability? Is there a nexus, a connection to the disability and what's being requested? And is the request reasonable? So keep that in mind as we move along here. The Americans with Disabilities Act applies to public and common areas, and it limits service animals to trained dogs and miniature horses. No emotional support animals that are just inherently comforting or soothing to somebody's disability. The animal needs to be trained to perform some type of task for the person with a disability. And no other species such as cats or ferrets or birds or anything like that. So this has to do with public spaces. So this will apply in your common areas. Some shelters, homeless shelters, are going to be covered by the ADA. They may also be covered by the Fair Housing Act if people are allowed to return to the same room or the same bed on a daily basis, if they don't have to get in line every day. Those are the kinds of factors that courts would look at to see if a homeless shelter is somebody's dwelling unit for the time that they're staying there, and covered by the Fair Housing Act. But at a minimum, the Americans with Disabilities Act is probably going to apply to homeless shelters. And then the Section 504 of the Rehabilitation Act tries to ensure that recipients of federal funds use those federal funds in a way that's most inclusive so that people with disabilities are granted reasonable accommodations when needed, and they have equal access to services, facilities, privileges in an integrated manner. So a housing provider could be covered by several of these laws: the Fair Housing Act, the ADA, Section 504 of the Rehabilitation Act, and our state law against discrimination. And they treat assistance animals a little bit differently. And so therein lies some of the confusion. So on January 28th, HUD issued this new guidance. They had previously issued a guidance memo that we'd relied on for a few years. And then this memo came out and supersedes that. It replaces the prior guidance from 2013. So the guidance is referred to as assessing a person's request to have an animal as a reasonable accommodation under the Fair Housing Act. So it's intended to help housing providers and advocates and housing consumers understand what is required in terms of making a request for a reasonable accommodation for an animal and what kind of analysis the housing provider has to go through. So the guidance memo affirms that this applies to all housing providers covered by the Fair Housing Act. It doesn't address the other civil rights acts besides the Fair Housing Act. So it's not going to get into requirements for Section 504 or the ADA. So if a housing provider believes that they are also covered by those, if they are receiving federal funds, if they have areas open to the public, they need to understand those requirements as well. It doesn't govern airlines and common carriers that are covered by other laws. So often we see, this is part of the confusion too about assistance animals in housing. Often we see the stories in the news about somebody bringing a horse or a turkey or something like that onto an airline, and it creates an uproar. But again, those stories about air carriers don't have anything to do with housing. So the Fair Housing Act doesn't govern airline carriers, and the laws that govern common carriers don't pertain to housing. So different laws, but oftentimes the requirements get conflated and confused in news reporting. And the memo instructs that this memo it's a guidance memo. It's suggested best practices. So it's not a requirement that housing providers adhere to what's in this memo, but certainly it's suggested that they do so, because this is how HUD is saying a housing provider can comply with the Fair Housing Act when assessing accommodation requests for people with disabilities for animals. But it's to be read in conjunction with HUD's other regulations about discrimination under the Fair Housing Act. And also it refers to the joint statement of HUD and Department of Justice regarding reasonable accommodations under the Fair Housing Act. This is a 2004 guidance memo. I included a link for it down here, excuse me, but it's in a question and answer format, pretty easy to read. And so if you're trying to assess a reasonable accommodation request, how to make one, when one should be granted, whether it's for an animal or something else, this is a good basic walkthrough of what can be considered, what's required, and so on. So it's also referred to several times through this new assistance animal guidance as equally important. So that is read in conjunction with this new guidance on assistance animals. And the HUD guidance says that it's prospective. So housing providers shouldn't go back into past reasonable accommodation requests. If a tenant has asked for an accommodation request and it was granted, a housing provider shouldn't go back and reassess it and go through another analysis and try and determine whether or not to grant it or not. It's prospective. All prior accommodations should be deemed still granted at that point. And there are two sections to this lengthy 19-page HUD guidance memo. Most of it is devoted to the first part, how to analyze a request for an accommodation for an animal. And it has 5 parts to it. And then there's a couple of pages near the end that provide some guidance, some best practices for how to document that somebody has a need for an assistance animal. So that's really good guidance for practitioners, health practitioners who are making a letter or a prescription for somebody who needs an accommodation for an animal, and for people who are requesting an accommodation, what they need to show that they need it. So we'll go through that as well, but that's the second part of this HUD guidance. So starting out with this guidance, what the bulk of it says here, assistance animals, they're not pets. There's two types. So HUD started using the term assistance animal, at least as early as the 2013 guidance, because the ADA uses the term service animal. It's a really specific term used for the ADA. But the Fair Housing Act doesn't have mention of any type of animal in the Fair Housing Act or its regulations. There's no definition of assistance animal, service animal, emotional support animal, anything like that. So HUD has used this term assistance animal as an umbrella term to basically cover any kind of animal that might be needed for a disability, which would include what you think of as a service animal, a trained animal, a CNI dog, something like that, and other animals that are often referred to as emotional support animals. So this memo emphasizes there's two types, but they're both assistance animals. And the analysis starts like this. So if a housing provider receives a request for an animal in housing, part one is to determine, is the animal an ADA service animal? Because the Americans with Disabilities Act has such a strict definition, it's quite limited. If an animal meets that definition, then the housing provider stops there and doesn't even need to go forward into further analysis. So the first part, part one, is the animal, does it qualify as an ADA service animal? Which would be a dog that is individually trained to do work or perform tasks for someone with a disability. And it could be for a physical, sensory, psychiatric, intellectual, or other mental disability. So it could still be for somebody that has a mental disability, but it can't just be for emotional support. It needs to do something, perhaps it's trained to walk circles around the person to give them more space from other people in a crowded setting. There was a case in Washington years ago in a Fred Meyer's public accommodations setting that involved that situation. So the disability could still be a mental disability, not just a physical disability, but the animal needs to be trained to do something that helps that person with their disability. Other species are not service animals, with the caveat that there is a little exception in the ADA regulations now that allows for a miniature horse. So dogs and miniature horses under the ADA. But the HUD guidance starts out with, is the animal an ADA service animal? So number one, is it a dog? So that's the first question. Is the animal a dog? If yes, you go on to the next question. If no, it's not a service animal. So then you skip part one and you move on to part two, where the analysis starts about, is it a support animal, that other type of assistance animal? If it is a dog, the next question is it obvious? Is it readily apparent that the dog is trained to do work or perform tasks for the person with a disability? Is the dog actively working? Can you see it helping somebody with balance? Is it a seeing eye dog? Something very obvious that it's doing. If it is, you stop right there. That's the end of the analysis. It's a dog, it's helping someone with a disability-related task, it's a service animal under the ADA. Any animal that meets the ADA definition is going to be allowed in housing because it's a stricter definition to meet that public accommodation ADA definition. So at that point, you stop, that's the easiest case. Dog trained to do something for a disability. If not, though, you go on to question 3. Okay, so if it's not obvious, it still may be a service animal, but just its task that it's performing isn't obvious. So then the housing provider can ask 2 questions. Is the animal required because of a disability? And what work or task has the animal been trained to perform? These are the same 2 tasks that other public accommodations can ask if somebody brings an animal into a public establishment, for example, a restaurant or a library. Is the animal required because of a disability? If yes, then what work or tasks has the animal been trained to perform? If the person identifies at least one thing that the animal is trained to do, one task that it's trained to do besides giving emotional support, then it's a service animal and should be allowed and permitted, and that includes in public and common use areas. So that includes areas in an apartment complex that are open to the public or common use by other tenants, such as the rec rooms, outside park areas, parking lots, hallways, things like that. So again, is the part one, is it an ADA animal? Is it a dog? Is it obvious that it's performing work for a disability? And if it's not obvious, you can ask the two questions. And if one task is identified to help somebody with a disability besides emotional support, you stop there. It's an ADA animal and it needs to be allowed. So that's part one. If it is not an ADA service animal, then you continue to part two, which is the analysis portion of the memo relating to animals other than service animals. So you skip right to part two if it's a cat, if it's not even a dog, if you're dealing with a cat, a chicken, a rabbit, something else, go to part two. If you're dealing with a dog that is only being used for emotional support, not some other type of disability-related task, you move to part two. So if you're in part two, a housing provider gets to make the following inquiries. Okay, has the person made a reasonable accommodation request to keep the animal needed for a disability? So a housing provider doesn't need to go around and ask everybody, do you need an accommodation? Do you need an accommodation? They should make policies known and available to tenants when they move in, and as time goes on, that you can ask for accommodations, and this is the process and so on. But you don't have, housing providers don't have an obligation to go around and ask everybody, do you need a reasonable accommodation? So part two, question 4 is, has the housing provider received a reasonable accommodation request? And it can be written or it can be oral. It does not need to be written, although that's preferable because it keeps everybody literally on the same page as to what's being requested, so that everybody understands what the starting point is, and if there's any follow-up discussions as to alternatives or why it's denied, it helps people understand what the starting request was. But it can be oral, and it doesn't need to use the phrase, I need a reasonable accommodation. As long as it's clear that somebody needs an exception to a rule or policy because of a disability, that's an accommodation request. And again, that's all addressed in that joint HUD and DOJ guidance memo. The request can happen at any time. This is a big frustration for many housing providers because often people will get an animal and not inform the housing provider, and then the housing provider sees the animal and is beside theirself and issues 10-day notices and says that this is a no pets complex. You knew that when you moved in. You know, how dare you? You broke our rules. Sometimes it's helpful to think about it in terms of, if somebody with a disability is prescribed something by a healthcare provider, usually they don't go and get permission from by their healthcare provider. They don't go and get permission from their housing provider. So if their healthcare provider says, hey, we think you should use a shower chair or start using a cane or something like that, the patient doesn't then go and ask permission usually from the housing provider. And so they, in their discussions with their healthcare provider, they may not even think about, it may not even be on their radar that this is something that they need to inform the housing provider about. But it often comes across as sort of underhanded, dishonest, trying to sneak an animal in and make it an assistance animal when it's really a pet. And certainly those situations happen as well. But people will take advantage of all kinds of situations. But the laws here are to protect people that do need assistance animals for their disabilities. So while it is acknowledged that it's frustrating for housing providers, HUD has emphasized in this guidance memo that the request can be made at any time, even after the animal is already there, even after they brought the animal into the housing, even after the tenant has received a termination notice from the housing provider for violating a no pets policy, the request for the accommodation can still come in and say, no, this is an assistance animal that I need for my disability. So it does clarify that, which has been a source of frustration and confusion, I know, for a lot of folks. A reasonable accommodation request can also involve more than one animal. This is something that HUD clarified in this guidance memo too, which I think is helpful, because this has been up for a lot of discussion among advocates and landlord attorneys and others about how many animals a person can have for a disability. So a person with a disability may have a need for more than one animal, or there may be multiple people in a household that each need an animal for their disability. So there can be multiple animals in housing. We're still just going to go through the same reasonable accommodation analysis for each one, but it is possible that there can be more than one animal in a particular dwelling unit for one or more people with disabilities.
Hey,
So
Marley.
yes,
We just have a quick question. I think would just kind of slide right in here. And I think that it's something that a lot of people have questions about. Are there certain breeds of dogs that are not included in the ADA accommodation?
No, as far as the Fair Housing Act. Now, I can't speak to specifically the ADA and breeds going out in public places. I'm unaware of any restrictions on that. I can say specifically and definitively that with respect to the Fair Housing Act in housing, a certain breed of assistance animal cannot be excluded just because it's a certain breed. And HUD does cover that in this memo. So just because somebody shows up with a pit bull assistance animal or a Rottweiler, or German Shepherd, or any of these other commonly thought of dangerous breeds, they still need to be considered and allowed if they, there's nothing inherently dangerous about that specific animal. So going out in public restaurant under ADA, I'm not aware of anything regarding specific breeds, but I can't definitively say. Fair Housing Act definitely all breeds need to be considered.
Right. Okay. And another question, does the Fair Housing Act also apply to co-ops?
Yeah, it would. It applies to condominiums, it applies to co-ops, it applies to duplexes, triplexes, extended stay, motels, where people, if it's your dwelling unit, the kind of situation it wouldn't apply to is a shared, if people are sharing an apartment or a house where they're sharing bathrooms and kitchens, roommates essentially, among themselves. So a housing provider couldn't discriminate against people within a unit, but the people within the unit can essentially discriminate against each other in terms of protected classes, assistance animals, whatever. So that's an exception for roommates, but co-ops, condos, homeowner associations, those are all covered.
So on the back of that, would it apply to clean and sober housing, such as like Oxford or Walker housing or anything like that?
Yeah, it should.
Yep. Perfect.
Yeah.
And
there are some nuances there that we, if there are some specific questions we can get into, but generally it should. It sort of depends on who is placing the people in the Oxford house, yeah, so there, it's possible that if it's the roommates among themselves that are selecting people, that there may be some limited discrimination that can occur. If there's kind of an overarching organization that is helping to place people into the housing, then they should be able to ask for reasonable accommodation requests.
Okay. Thank you. We have a couple more questions, if that's okay. I know you were on a roll,
sure.
but
Yeah.
some really great questions. Somebody wants to know, Debbie Hurst wants to know, can the tenants self-proclaim that they are disabled, or do they need to show proof, such as being on SSDI or having a physician or a medical provider confirm that they are truly disabled?
Okay, good question. So I'm going to hold that one just because I do have a section on verification.
Perfect.
Short answer, if it's obvious that the person has a disability, they're in a wheelchair or something, then they self-proclaim, that's fine. Because so many disabilities are invisible and unseen, housing provider can ask for some other verification, some kind of a third-party verification, which might be an SSI verification, a letter from a healthcare provider, something like that.
Okay, and so right now we're discussing, somebody wanted to know, right now we're discussing companion animals in this section right here, right? We've moved on from service animals to like therapy / companion animals. Is that correct?
Yeah, the terminology, it does get confusing because they're all under the term assistance animal, any kind of animal needed for a disability. But in this guidance memo, HUD does really differentiate. They go back to the service animal that performs a task very much like a ADA service animal. And then if it's not that, then we move into this other analysis, which is doesn't necessarily have to be a emotional support animal, because it could be maybe you have a non-dog, some other animal that's trained to do something, so it's acting much like a service animal for, let's say, a physical disability. It's trained to pick something up for you, or go fetch something, but it's not going to meet the ADA definition because it's not a dog. So this is the catch-all of everything else that's not an ADA animal.
And one last question, I'll let you continue. And can you have more than one companion animal?
Can you have more than one? Yep, and that's perfect because that's the slide that we're on right here, where HUD did clarify in this memo, which I'm thankful for. I'm always happy when we get some definitive direction from HUD or the courts or DOJ, so that I can tell people this is actually what is being said by these enforcement agencies, as opposed to just opining what I think they might do or say. So yes, you can have more than one ADA type service animal, you can have more than one emotional support animal, you can have more than one non-ADA animal that performs a task, picks something up that happens to be a non-dog. So yes, there can be multiple animals, but they all need to meet the assessment tests that we go through. The person has to have a disability, they have to need each animal for the disability. And in the case of an emotional support animal, if you think about it, if somebody is really bonded already and attached emotionally to a couple of animals, let's say they have 2 cats, while each cat may not do something separate from the other cat for that person, if they were to lose one of those cats, it could be that that has really adverse implications on the symptoms of their disability. And so a housing provider may say, in fact, yes, they do need 2 emotional support cats for their disability. So, okay, so moving along then to part 3. So a reasonable accommodation request has been made. So then the next thing is really that first prong of those 3 prongs that I started out with. Is there a disability? Is there a nexus, a disability-related connection to what they're asking for? And then is it reasonable? So this is the disability portion. Question 5, a reasonable accommodation request has been made. It's not an ADA service dog. So does the person have a disability? So this goes into, how do we know that somebody has a disability? Because there are many that are obvious, there are many that are not obvious, and people may say they do when they don't. How do we know? How does a housing provider know? Well, a housing provider doesn't need to try and diagnose somebody, and they shouldn't, so they don't get to play doctor. If it's an obvious disability, somebody is using a red and white striped cane, it's obvious that they are blind or sight impaired or deaf or in a wheelchair. Physical disabilities are often the most obvious, but not always. Sometimes cognitive and mental illness disabilities are quite evident. But the housing provider gets to determine, is there an observable disability? And if so, then their person is deemed to have a disability. Don't make the person go get a letter from their doctor if they're in a wheelchair saying they have a disability if it's obvious. Or does the housing provider already have information that, even if it's not obvious, they have information that indicates the person has a disability. Maybe when they applied for housing, they provided proof of income as SSI. So the housing provider knows they're on SSI. It's harder to qualify for SSI than it is to meet the definition of disability under the Fair Housing Act. Or maybe the person is receiving a HOPWA voucher, which is specifically for people with HIV. If there's something that indicates that the person has a disability, then the housing provider can go on that. So a disability under the Fair Housing Act can be physical or mental, and it's deemed a physical or mental impairment that substantially limits one or more major life activities. So physical or mental, and substantially limits one or more major life activities, which are things like walking, lifting, breathing, working, those kinds of things. And some impairments, this is all from the HUD memo, are readily observed, and they give a bunch of examples: blindness, some neurological impairments, cerebral palsy, Parkinson's, so on. And then they also note that several impairments are not observable, in which case the housing provider gets to ask for verification that there is a disability. In some cases, some conditions will virtually always be deemed a disability. And so again, HUD gives a list here of things that are almost always deemed disabilities under the Fair Housing Act. But again, it's a non-exclusive list. There can be other conditions which are also disabilities. And I also like to note, or want to note here, that the Washington law against discrimination, this is one area where it diverges from our Federal Fair Housing Act, in that it is even more liberal in its definition of disability. Our state law recognizes temporary disabilities. So if somebody has a condition that they're expected to ultimately recover from, during the time they have that, a broken hip or something, they may be deemed to have a disability under our state law. Under the federal law, court cases have whittled down some of those conditions as disabilities. If somebody's going to recover from it, it's only temporary, or it's something that can be mitigated with technology or medication so that it's not having symptoms manifested. So, but our Washington law is much broader. And interestingly now, COVID-19 has become a topic of discussion as to whether or not it's a disability. I'm not sure under the Federal Fair Housing Act how that falls out yet, but under our Washington law against discrimination, certainly if somebody is experiencing severe COVID symptoms during that time, they're probably going to have a temporary disability under our state law. So in part 3, again, this is the criteria for assessing whether to grant a reasonable accommodation. If a disability is observable, it's obvious, then you go on to the next phase to determine the nexus. Is there a disability-related need for the animal? But if it's unknown, you go on to the next part, and this is the verification for disability. How do you know, if you can't tell, if it's not obvious, how do you know that somebody has a disability? And these are the types of things that HUD has indicated in its memo can be used to verify that there's a disability. A determination letter from a disability from a government agency, like a SSI letter, receipt of disability benefits or services, SSDI, people who receive SSI under 65, veterans disability benefits, services received from vocational rehab agencies, or other disability related services from other agencies. If somebody's receiving housing assistance or a voucher specific to people with disabilities, that would be proof of disability. And then the bottom one is what we most commonly think of in terms of verification, is information from a healthcare professional confirming that somebody has a disability. In the joint guidance memo from HUD on reasonable accommodations, HUD states the types of people that can be a third-party verifier, and it's much more liberal than what's included in this memo here. And this, with respect to assistance animals, you can see HUD moving more towards it being a healthcare professional. Still does not have to be an MD, a medical doctor. They include other examples such as optometrist, psychiatrist, psychologist, physician assistant, nurse practitioner, and nurse. But it is more restrictive than in the joint guidance memo from HUD to verify disability for other types of accommodations, which it can include basically just a reliable third party. Could be a disability advocate, a social service provider, a social worker, somebody who's a sponsor in an AA or NA program, something like that. But with respect to the non-ADA animals, HUD is moving towards at least healthcare professional here as a best practice. HUD notes that housing providers cannot require healthcare professionals to do the following: use a specific form to verify the disability or need for the animal. Housing providers can have their own forms, and to the extent it facilitates efficiency, they can offer them to people who are asking for reasonable accommodations to take to their healthcare provider to complete, but they cannot require that the tenants use those specific forms. And they can't require notarized statements from the healthcare provider or require the healthcare provider to make a statement under penalty of perjury. And again, I'm glad to see clarity on these issues in this HUD guidance, because that's been sort of a back and forth issue too. A lot of housing providers were asking that healthcare providers do notarize their statements or make the statement sworn under penalty of perjury to dispel or to try and reduce fake assistance animals or something from being prescribed. But it also, on the other hand, has the chilling effect perhaps of limiting a healthcare provider's options, treatment options in servicing their patients by making them not want to sign these things when it really takes another tool out of their arsenal to treat people if they do feel it's warranted to prescribe something like an animal. So anyway, HUD here says you can't do that. You can't require that they sign under penalty of perjury. And housing providers should not have to provide the diagnosis or specific details about the nature or severity of somebody's disability. A housing provider gets to know that the person has a disability under the Fair Housing Act, but not necessarily what the disability is, what their symptoms are, what medications the person takes. And this is something that healthcare providers don't always know either. Sometimes they'll err on the side of disclosing way too much information that does violate the person's privacy. So again, diagnosis and details, you can't require that. And then HUD touched a little bit on the internet verifications, and I was glad to see that. Again, something that's been evolving as our technology capabilities expand. We have more capability to interact with our healthcare professionals online, but then it creates questions of what kinds of documentation would satisfy a verification for a reasonable accommodation, particularly for an animal. So the guidance that HUD has given us here, they note that some websites do sell certificates or registrations for assistance animals if people just answer a couple of questions or pay a fee. And HUD says that documentation by itself is not sufficient to establish disability or disability-related need for an animal. If you look at some of these documents or registrations that people obtain, often they're focused on the animal itself, saying that this certifies that such and such animal is a service animal or is an assistance animal or something. The disability reasonable accommodation analysis under the Fair Housing Act doesn't focus on the animal itself, it focuses on the person. Does the person have a disability, and do they have a disability related need for the animal, regardless of what it's called, what registry it's on. So in a way, these sites, I think, do prey upon people with limited fixed income who pay a fee to get a letter that says that their animal is on some registry. And there's no requirement under the Fair Housing Act that any assistance animal be on a registry or have a written certification or anything like that. So they think that they're getting something that they need, but they're really paying money for something that they don't need and that doesn't say anything about them having a disability or their disability related need for the animal. So if you see a document that says the animal's on a registry or is a certified service animal, that alone doesn't verify a disability or disability related need. So conversely, HUD notes that reliable documentation from an online healthcare provider would be a note from a healthcare professional that confirms a disability, so says, yes, this person has a disability, and or confirms the need for the animal for the disability, and indicates some kind of personal knowledge of the individual. So that would be the best practice type of documentation. You know, yes, I have knowledge of this person, yes, they have a disability and a disability related need for the animal. So there are some legitimate healthcare services that can be received, especially today when we're all trying to avoid each other and stay home. Many people can just get on a video chat with a healthcare professional and receive some information and care or diagnosis. And so there are legitimate reasons for that. People who are homebound or in rural areas, it may be more helpful to access healthcare professionals that way. But really, I think the emphasis comes down to is the letter about the person's disability and their need for the animal for their disability, or is it just about the animal being on a registry or something? Okay, so continuing on, has the person requesting the accommodation provided information that verifies that they have a disability? So if you've determined disability, it's either obvious or there's some kind of third-party verification based on their income source, the services they receive, healthcare verification. Then you go on, and this is our nexus section. Okay, they have a disability. Do they have a disability related need for the animal? Just because you have a disability doesn't mean that you necessarily need an animal. So this is often where the healthcare provider's letter draws that second prong. They meet the second prong. Yes, they have a disability, and yes, they have a disability related need for the animal. So if a person does not provide verification of disability or a verification of the need, the accommodation request can be refused. But if they provide verification of disability and disability related need, then you go on to this section. And this is a new section that wasn't included in the prior HUD guidance. This goes into the type of animal, common household animals versus unique animals. And so once the person has provided a reasonable accommodation request, verification of disability and disability related need, then the housing provider can look at what kind of animal is it? Is it commonly kept in the household for pleasure versus commercial purposes? And so if it's a dog, cat, small bird, rabbit, hamster, gerbil, rodent, fish, turtle, or other small domesticated animal, you stop there, grant the reasonable accommodation. So if it's these types of animals, you stop there. Now, I think a lot of housing providers have seized upon this to mean then if it's not one of those, if it's some kind of unique animal, they don't need to grant a reasonable accommodation. But I don't think that's the case, and I'll walk through what HUD says here. So the types of animals that are considered unique animals or not common household animals are reptiles other than turtles, barnyard animals, monkeys, kangaroos, and non-domesticated animals. Now, you may already be in a jurisdiction that limits types of animals or numbers of animals, and if that's the case, a housing provider would be able to say, sorry, you know, in our city here, it's not permitted to have a llama or a cat or something, or a chicken. And if somebody wanted to make a reasonable accommodation request to the jurisdiction, they could do that. We did have one, just to give an anecdotal scenario here. Our office worked on a case a couple of years ago involving, it was houses. There was a family lived in one house, and the son, there was a young son, I believe, had autism, and he became really attached to the neighbors. They had a series of a variety of animals, barnyard animals and stuff, and he became really attached to one of those animals. I think it was a goat, perhaps. And the one household with all the animals got in trouble with the city. They had the wrong number, the wrong types of the animals, but the family with the boy was able to make an accommodation request to the city for an exception for them to be able to keep the, I think it was the goat. So anyway, if housing providers, you know, can convey what the law says and ask their tenants to abide by that. But there are instances where if somebody has a disability-related need for an exception to one of our zoning regulations or laws or ordinance, then they can appeal directly to the local jurisdiction for that. But assuming that there is nothing to preclude a llama or a monkey or something like that in your jurisdiction, somebody can still ask for a reasonable accommodation request for one of these unique animals. HUD says they can be requested if the need involves unique circumstances. But the circumstances that they list really, I think, just goes back to the same thing that verifies other animal needs, whether it's common or uncommon. So the examples they give for unique circumstances are that the animal's trained to do work or perform tasks that can't be performed by a dog. So a monkey that picks up something, has fingers and digits, you know, specific to a disability-related need might be an example of that. But then they have this other thing that I have kind of highlighted here in the middle. Information from a healthcare provider confirms that first of all, one example is allergies prevent the person from using a dog. So apparently they're allergic to a dog, they need another animal. Or without the animal, the symptoms or effects of the disability will be significantly increased. So really, I think that's a big catch-all there. So that whether it's a common or uncommon animal, if you have a healthcare provider saying that the person needs this animal for their disability symptoms, that's the verification right there. The other example they give is the individual seeks to keep the animal outdoors in a fenced yard where the animal can be appropriately maintained. So again, maybe that's the goat is in an enclosure in the backyard or something. But that middle section, I think, is really a catch-all. So a lot of housing providers, I think, heard that this guidance makes a differentiation between common household animals and unique animals. But really, when you go into the unique animal analysis, if you have a healthcare provider saying that somebody needs that chicken or whatever it is for their disability, you know, I think that requirement has been met. Okay, and then part 5 of the first part of the memo. Remember, there's 2 sections. The lengthiest part of the memo is this first section that has 5 parts about how do you analyze a reasonable accommodation request for an animal. And part 5 gives some kind of general guidance for people trying to assist or respond to an accommodation request. So you can only refuse a reasonable accommodation for an animal if the specific animal poses a direct threat. So just because the animal is a dog or a Rottweiler or something that you think is a dangerous animal, you can only deny it if you have knowledge that that specific animal is a direct threat. You did a rental reference check and found out the animal was aggressive to people in the last household, biting or something like that, then that specific animal might be a direct threat. But HUD also qualifies that and says a direct threat that cannot be eliminated or reduced to an acceptable level through actions taken to control the animal, like keeping it in a secure enclosure, might be putting a muzzle on the dog, something like that. So that goes into the analysis of whether or not it's a direct threat. So it has to be the specific animal, and the direct threat of that specific animal can't be mitigated somehow through control. As a best practice, HUD suggests that housing providers respond promptly to reasonable accommodation requests, generally within 10 days of receiving the verification of disability documentation. In the HUD and DOJ Joint Guidance Memo from 2004 on reasonable accommodations, there's language in there that suggests that non-response to a reasonable accommodation request can be deemed a denial. So if a housing provider receives a request, doesn't respond to it, just sits on it, ignores it, ultimately that person may go and file a fair housing complaint and say my request was never responded to. I was denied being able to have my assistance animal. So the suggestion here for best practice is respond promptly and within 10 days of receiving verification. And before denying a reasonable accommodation request, engage in a good faith dialogue, which is often referred to as the interactive process. It might be if the person hasn't gotten the animal already and they're proposing to get a Great Dane or something like that, the housing provider might say, well, is it possible that you get something smaller? Does it have to be the Great Dane? And maybe they need the Great Dane. Maybe it turns out the Great Dane is what they need for balance or something like that. But there can be an interactive process to discuss alternatives rather than just saying, no, we're not going to allow you to have this accommodation. And so again, enter into interactive process, discuss alternatives if available. The person with a disability does not have to allow or agree to alternatives. They're deemed in the best position to know what their disability-related needs are, but there might be something that they haven't thought about that the housing provider can offer. Other general considerations, once the accommodation request for an assistance animal is granted, a housing provider can't charge a fee for processing a reasonable accommodation request. So if the housing provider consults with an attorney to get information and guidance on whether or not they should grant this request, they shouldn't pass on that attorney fee to the person asking for the accommodation or charge them some kind of a fee. Can't charge a deposit fee or surcharge for an assistance animal. Think of them as more like an auxiliary aid, like a wheelchair or something that you can't put a fee or deposit on. Housing providers can do so for pets, animals that aren't needed for disabilities, but they can't charge fees for animals needed for disabilities. If the animal, however, does damage the property, then the tenant is liable for the damage, as would be the usual practice for the housing provider to charge. So if they usually charge tenants for damaging carpets, spilling grape juice on the carpet, painting on the walls, whatever, and then they have an animal that damages a property, similarly, they could take that out of a security deposit or ask the tenant to pay for it. Pet rules don't apply to service and support animals in housing. So housing providers can have rules about pets, but they don't apply to service and support animals. With that said, though, animals need to be under control of the owner. They shouldn't be running at large or, barking constantly, biting people, going to the bathroom everywhere, that kind of thing. So pet rules don't apply, but there can be some limited rules or or assistance animal addendums, which are usually kind of scaled back pet rules for assistance animals. And then this goes to one of the questions that was asked earlier. HUD specifically says that a housing provider cannot limit the breed or size of the dog used as a service or support animal. Interestingly, they said dog here, so, but I would take that to mean you can't limit the breed or size of any kind of animal. But most often this arises in the area of the pit bulls, the Rottweilers, the deemed dangerous breeds. You can't limit it, but if you know specific information about the direct threat of that animal that can't be mitigated, then you could limit it. There is a guidance memo. It's several years old now. I want to say it's about 2006 from Brian Green at HUD. That it's about a 2-page memo, and it addresses the issue of insurance and breeds, and says basically that if a housing provider would lose their insurance coverage or their rates would go up and they can't find comparable insurance in the market elsewhere, for the similar costs. So there's this affirmative duty that they have to shop it, with their agent or something to determine that, yeah, we really can't get insurance coverage if we allow this Rottweiler in as this assistance animal, then that could be an undue financial hardship, and the housing provider could say, no, we can't allow it. But insurance is covered by the Fair Housing Act as well when it's on housing. So the Fair Housing Act, we've been talking lots about rentals, but it applies to sales of housing, mortgage lending, insurance of housing. So housing transactions are covered. And so that memo concludes by saying that insurance companies that don't allow accommodations for people with disabilities will be referred to Department of Justice for enforcement. So if a housing provider is dealing with a breed limitation issue with their housing provider, it would might be a good idea to send that 2-page memo over to the insurance agent and say, hey, you and we both need to make a reasonable accommodation for this specific pit bull that we don't have any direct knowledge of any direct threat, and allow it as an assistance animal. So, but breed or size of the dog can't be limited. And then the person is responsible for the care and control of the animal. So the manager shouldn't have to feed the animal or take it on walks or something like that. Okay, now we're moving finally to the second portion of the guidance notice, and it's only a couple of pages, but this is where HUD has tried to give some tips to people with disabilities who need to verify that they need an animal, and that they may be able to share this with their healthcare providers as well, to give some direction to the healthcare providers about what to put in a letter. Sometimes the letters are too cursory, and sometimes they go into way too much detail about the person's disability. So this is some best guidance from HUD on how to verify somebody has a disability and a disability-related need for an assistance animal. So including the patient's name, including something about whether the healthcare professional has a relationship with the patient client involving healthcare services. So often you'll see something that says, I've been so-and-so's doctor for 5 years, or I've known this person, in a professional capacity since whenever. So some kind of statement like that was a best practice to verify that there is a therapeutic relationship between the healthcare provider and the person needing the accommodation. Signed and dated with contact information and any professional licensing numbers or information for the verifier. And then verification of the disability, stating that the person has a physical or mental impairment that substantially limits one or more major life activities. Again, the diagnosis doesn't and shouldn't be disclosed, just simply a statement, this person has a physical disability that substantially limits major life activities, or has a mental impairment that substantially limits major life activities. That's sufficient for the Fair Housing Act. And then if the letter is also meeting not just verification that the person has a disability, but the prong of verification of need for the animal, then going on to say that the person needs the animal because it provides work or assistance, that's your ADA service animal, or provides some kind of a therapeutic emotional support, or does something to alleviate symptoms of a disability. So the animal is needed for the disability. And then a discussion of the type of animals. It's a cat, a dog, whatever it is that's being prescribed. And if it's not an animal traditionally kept in the home, so again, this is the uncommon animal situation, or the unique animal, adding a little bit more to verify that there is a relationship between the patient and the prescriber, maybe the date of last consultation, any unique circumstances about this specific animal being needed. This person needs this specific goat because they're, for their mental disability, it, alleviates symptoms of their disability or something. And so just a little bit more information if you're dealing with a unique animal suggested. So that concludes the new HUD guidance in January. They issued this to try and make it more understandable, make the issue simpler, but sometimes it seems like the more there is, the more complicated it is. But really, if you remember nothing else, just go back to assistance animals or service animals in housing are really just a reasonable accommodation analysis. Is there a disability? Is it obvious? If not obvious, you can ask for third-party verification. And then if there's a disability, is there a disability-related need for the animal? Do they need it for their disability? either to perform a task like an ADA animal or to alleviate symptoms of a disability, maybe like an emotional support animal. And then is it reasonable? Is there anything that's known about this specific animal that is dangerous, is a direct threat? Did the animal destroy the last apartment that they lived in? Those things might factor into reasonableness. And then this guidance can be used as some best practices in terms of trying to figure out what needs to be in the letter. There's a little bit of clarification in this guidance about internet prescriptions as that issue arises more and more. But there's more emphasis on having a personal therapeutic connection between the healthcare provider, verifying that in the letter as a best practice. So I think that is where I'm going to conclude, and then I'd open it to any questions that have come in since. Not sure if Amanda is there. I'll attempt to scroll down and see. Oh, go ahead.
Yes, sorry about that. I was talking with my mute button on.
Oh, yeah.
So, which seems to be a regular occurrence for me. So there are quite a few questions, and there were a handful that you answered as you went, and I was hoping that you would be able to do that. So thank you very much, Marley. That was a fantastic presentation. You answered actually a lot of questions that I had when I was doing direct service. So since we have about 15 minutes left, I was hoping to go through here and just ask a few questions that seemed like maybe we had the time. Let's see here. So we did ask the breed question, and then the co-op question, and let's keep going here. There we go. Okay, and then so you talked briefly about, well, more than briefly, about the obvious physical disability piece. Like
Right.
if somebody's in a wheelchair, they're probably not going to need to bring in proof of a disability. So there are a couple questions. If you're still looking at the question box, I'm not sure if you are, but if you scroll up to about 909, 915, you'll see Sarah asked a question, and she said if they're using a walker or a cane, or if they show up like in a wheelchair, and stuff like that, that's that obvious piece. Obviously that's a necessity. They need this animal if they're saying that this is, blah, blah, blah. So I think that you covered that piece pretty well. It would be great if this would stop scrolling by itself. And then Stanton mentioned, did you say that they don't have to provide information from a doctor to prove that they are disabled?
Right. That's correct. It can be other forms. It can either be, the obvious person, again, the wheelchair is the most easy example, or something that's not from a doctor but verifies they have a disability, an SSI award letter, they're under 65, they're getting a HOPWA voucher or something, or a voucher or housing assistance specific to people with disabilities. If there's something showing that they are receiving disability services or financial assistance, that would suffice to prove that they have the disability. Now, proving that you have a disability doesn't always mean that proves that you need what you're asking for as an accommodation, but you don't always need a doctor's letter to show that you have a disability.
Okay. So Desiree wanted to know too, most doctors won't write out what the actual diagnosis is, but they'll state that a person has a disability. Would that normally suffice? Yes,
and actually they shouldn't write the diagnosis. A best practice would be to state actually the definition from the Fair Housing Act. And there's a lot of form letters out there, but something that says the person has a disability as defined by the Fair Housing Act, which is a physical impairment that substantially limits one or more major life activities. But that's it. Yeah, they shouldn't disclose the diagnosis. Stating they have a disability is good. And then even if you define further, the Fair Housing Act definition would be the best.
Okay, great. And then Shri wants to know, she said that she was in a training, and somebody said that it could be anybody who writes the note that maybe works or that knows that the person has a disability. So her exact words were, I was in a training and they stated that anyone who knows that they have a disability could write the note, that they do not have to be a healthcare professional. What is your take on that, Marley?
Okay, yep, this is where it gets a little confusing, because if you go back to just reasonable accommodation guidance, that 2004 memo from HUD and DOJ, which still stands, where they're talking about not just animal accommodations, but any kind of reasonable accommodation, might be for parking, caregiver, whatever. There is specific language in there that says that the third party verifier can be, and they give a list of people, and they say it's a non-exclusive list, and they include people that aren't doctors, that are like social workers, things like that, peer support, what is it, like a peer support specialist or something, and reliable third parties who are in a position to know. So the first takeaway is that, yes, somebody can verify a disability or a need for a reasonable accommodation that's not a healthcare professional. In this newest guidance now that's specific to assistance animals, HUD's saying that this guidance is not a requirement, it's a best practice guidance, but they are leaning towards using more of that healthcare professional language, and I think that just shows a change from kind of perspective from 2004 to today, as there's been more outcry about everybody can just get an animal and anybody can verify it. So the best practice is that it come from a healthcare professional for a emotional support type animal. But again, there's nothing in the Fair Housing Act that discusses this, who can verify an accommodation or an animal, and a court might interpret it differently. But as best practice, specifically when you're dealing with an emotional support animal, I would, if possible, have a healthcare provider do it. So that's kind of the long-winded answer of saying they're both correct.
That makes sense to me, actually. I think that there was a point in time during my direct service experience when I had to write a letter stating that a participant had a disability and that they also had a cat, and that they relied heavily on their cat for this disability to help soothe them. And it was their words, and I was just writing it out and signing my name from what I had witnessed to make a reasonable accommodation. But I wasn't a doctor, and I wasn't a nurse. I was a housing specialist. And so, but I knew I was allowed to do it, you know, but it was just it was just my observation on paper. And so, you know, but it stood, it worked. It's just one of those things where you have to consider the source, I think. So it just, you know, so another question from somebody else was Hannah Citran. And so I think this might be, and if you feel like maybe this is something that you need to respond to in type, and so maybe you can write this out later and we can send it through the question and answer piece, that's perfectly acceptable, because I'm not sure if this is something that I'm not sure if this is something that you want to discuss verbally right now, but it is kind of big. Is there evidence, or if there's evidence or history of neglect of a tenant's current companion animal, or can you decline to allow them to bring another companion animal or dog because of this neglect? History includes malnourishment of the animal, unsanitary conditions, etc.
Right. I'll take that real quick. I think, first of all, if there's any concern about mistreatment of an animal or neglect, that somebody could call a SCRAPS or an animal control type organization to report it, just as if you suspect child abuse or something like that, child neglect, you can call CPS anonymously. So if that's happening, you can do that. From a housing provider standpoint, I don't think personally I would recommend getting involved and making a determination on, you know, whether the cat is malnourished or not, or being fed or not. But a housing provider can get involved in if the neglect or the waste is causing a problem to the premises. And so that's where, you know, perhaps 10-day compliance notices regarding cleaning, cleanliness, or damage, the housing provider has some control there. And I probably then wouldn't get involved in prohibiting, you know, what can be prescribed for their disability. I would just work on the management of whatever animals they are allowed to have or prescribed to have for their disability, that they're not damaging the place. And if there's concern about neglect or abuse, you know, reporting that.
That would make sense. Thank you. Also, somebody, Paula wants to know if, can you speak about how to determine when or if animal care expenses can be claimed as a deduction in Section 8 housing if somebody has a service animal?
Oh, that's an excellent question. I can't speak to the specifics of that. I know that that is often an allowable expense, but I don't know the details without, reviewing and looking that up on what would be allowed. But I have heard that people with an animal that's required for a disability can have their income that's countable reduced by the amount of vet expenses, things like that, maybe even the feeding care. So I don't know the details, but I have heard that. I believe that that is possible if somebody is wanting to take that as an offset to their income and calculating their eligibility for housing assistance.
Thank you. Okay, and so because these are two questions, basically the same question, back to back by two different people. It's in respect to animal behavior. So service animals who are noisy, disruptive, waking up neighbors, this kind of situation, can a tenant be evicted for a dog barking or being disruptive, or who gets to determine what's unreasonable in terms of that behavior and whatnot? So that's, I guess, like that's the question, because like there are certain like people in the behavioral health world. I know that in behavioral health, if somebody were to bring in, when I was doing groups, if somebody were to bring their service animal in, we had the expectation that the service animal wouldn't sit there and bark the entire time or growl at people. It sat there quietly and behaved like a service animal. I think that same expectation is that when somebody has a service animal in their home, that it's not constantly barking and causing a ruckus. What do you believe? What's the requirements about service animal behavior, and can there be evictions behind that, or what's unreasonable in that situation?
Yeah, that's a challenge for sure for a housing provider, for managers. I wouldn't focus so much on it being an animal. I'd just focus it on either being a noise issue or smell issue or hygiene, maintenance, damage issue, those kinds of things. So there's typically provisions in leases and rental agreements about, not disrupting the peace and that kind of thing, but it does get really subjective. How many barks is disrupting the peace, but you also have that same thing with children, that are pitter-pattering, running across the floor above somebody who's in the downstairs unit, cooking smells. I mean, there's all kinds of things that happen in multifamily housing, and so there's no hard and fast, easily measured thing in terms of how many barks is unreasonable. But if a housing provider is receiving multiple complaints about noise, if tenants left and right are moving out because of the noise, those kinds of things, then the housing provider is going to be able to argue more undue hardship. But I think they're best managed with compliance issues, like any kinds of noise or disruption, disturbing of the peace. 10-day compliance notice. We received 3 complaints that your animal barked nonstop for 6 hours or something. You need to remedy this within 10 days. That might spur the person to take some mitigation measures, get some training for the animal, crate train it, muzzle it, do different things, take it to a care sitter during the day. But compliance notices, there's no hard and fast number of, how many barks or anything, but it's when it's becoming disruptive to, a reasonable person. Everybody some people have a heightened sense of any noise that any neighbor makes is going to be disruptive to them, and that's just challenging in multifamily housing. So not an easy answer to that, other than if it's starting to, people are starting to complain a lot and move out. It's not just one person seeming to be hypersensitive.
Right. Okay, well, we only have a couple of minutes left. So there are some pretty substantial questions left that I think will require your attention per usual. because you always give such informative webinars, Marley. So what I'm going to do now is I'm going to say thank you very much for your time and how much we appreciate and respect everything that you've offered to us today. And I will send you the rest of these questions, and I'm sure that you'll, when you have the time today, you'll respond to them so that I can get everything out to everybody. To the rest of our listeners, I want to say thank you to you as well. Please know that all of these slides will go out to you. There's also something in the to be downloaded that Marley included right there in the handout spot. I will also attach that as well for assistance animals in housing. I will attach that into the follow-up email with the slides and additional resources that we have available. And I want to say thank you for attending. Thank you for your attention. Thank you for your time. Thank you for your devotion. And please stay safe out there, everybody. Keep tuned in. And if you need anything, we are here. Reach out and email us. And Marley, thank you one more time for everything. We appreciate you very much.
Oh, thank you everybody for taking the time and for the opportunity to share. And my contact information's on there. If people have questions in the future, don't hesitate to look me up. Thank you so much.
Thank you again. Stay safe, Washington. Bye, guys.